And 2 doses of the AstraZeneca COVID-19 vaccine can provide about 85 to 90% protection against symptomatic disease. This according to statistics that have been released by the Public Health England on Thursday. The health body estimated that 13,000 deaths have been prevented in England as of May the 9th. In people aged over 60. It also suggested that vaccinations have stopped almost 40,000 hospitalizations among those above the age of 65. This new data shows that vaccines can go a long way in saving lives and protecting you from ending up in hospital with COVID-19. Joining us on the broadcast, we have Dr. Rahul Modi, an ENT surgeon at the Hiranandani Hospital in Mumbai. We also have Dr. Rajesh Chawla, pulmonologist from the Indraprastha Apollo Hospital. Thank you, doctors, very much for being with us. Dr. Chawla, if I can begin by asking you about, this latest study, whether it's the MAX study or the Public Health England study that talks about vaccinations working clearly. Those who have been given 2 doses of the vaccine are definitely better protected.
I think it is definite, because this is the most effective thing and that is the only way to prevent further surge. One of the studies were done by IMA among the doctors who died during this surge, and they found only 3 doctors out of the, I think, 200 doctors who died, only 3 doctors were there who were fully vaccinated. You can imagine that probably this is one of the reasons that if you fully vaccinate, you definitely prevent the death. Of course, there would be some odd patients who could still die because you've been vaccinated. But what we've seen is people are getting mild disease, that is understood, but they are not getting into the ICUs. And even if they're getting into ICU, they mostly are recovering. So that's the only way forward, the double vaccine. Whichever has been found to be effective in different trials is the way forward, and that is only can save us.
Dr. Chawla, before I bring in Dr. Modi into the conversation, I also want to ask you, are you then concerned about the low level of vaccination? If you look at the figures in the last 2 days, it's been the lowest dip in vaccination that we've seen in 2 months. Only about 11 lakh people have been vaccinated in the last 24 hours, for instance. So are you concerned about the low level of vaccination, the pace of vaccination in India?
Definitely. Because you see, we are doing lockdown, it is affecting economy, it is affecting so much, and spending some money. Wherever you get a vaccine, we have a large population. Unless majority of is vaccinated, we cannot save. And they are doing a children trial because there is a lot of fear among people that because the adults are getting vaccinated now and the children are not, probably unprotected, and third surge may have more impact on the children. So they not only should include the adults and quickly do the trials in children in maybe 2-3 months time, and leaving aside red tapeism, and they should introduce fast because it's the human lives, and it has been found to be effective in different studies in different countries, so we can definitely apply to our country.
Right. I think the slow pace of vaccination continues to remain a huge cause of worry. Many people now who are wanting to get the vaccine are actually not being able to get enough slots. Dr. Rahul Modi, the other big issue at the moment that India is facing is the black fungus. What more can you tell us about this black fungus now being notified as an epidemic?
So notification definitely helps in terms of keeping track of patients and keeping a data, right? It will tell us what is the ground reality. But I want to use your channel as a medium and send a message across to all the viewers that to a large extent, black fungus as a complication of COVID care is largely preventable. See, most of our patients are developing this 10, 20, 30 days out of discharge. And we have solid data to show in our hospital setup, more than 5,000 patients, and luckily no one has developed black fungus, all severities. And I feel a strong message should go for good follow-up post-discharge. That's the most important thing.
Right.
Good sugar monitoring post-discharge, keeping our antennas on high alert for those early symptoms of black fungus, which are not very different from a regular cold, like a mild pain, nose block, those things are something that the patient should be very, very made aware of, and they should immediately contact their respective doctors.
Right. Dr. Rahul Modi, the other big question about black fungus is, why is it that we are seeing an escalation in the number of black fungus cases here in India? In your understanding, has this happened anywhere else in the world? Or
So-
is this predominantly emerging as the repercussions of the second wave in India?
So cases have been reported world over. Definitely we have been hit harder, and I think that is reflective of because of three things or three reasons. One, again, going back, we are the diabetes capital of the world. We have the largest number of diagnosed and undiagnosed patients perhaps across the world. And the steroids that are being used, and steroids, mind you, are the only proven life-saving drugs in the treatment of COVID. So there is no way around their usage. We need to keep a strong follow-up of these patients. Most of these patients, we are able to control their sugars when they are in the hospital. It is only when they leave their hospital, and it is important to understand that steroid not only raises the blood sugar, but also affects or suppresses our immunities in many other ways.
Right.
So that is what it makes us prone to. So it is important to inculcate a sense of responsibility with the patients too once they are discharged from the hospital, and keep a good check on their sugars along with their temperature and oxygen levels.
Right. We also have Dr. Bala Subramaniam, a pulmonologist, joining us from Hyderabad. Dr. Bala Subramaniam, if I can just, very quickly ask you as well about black fungus. This is emerging as a huge cause of concern. What are you witnessing at the moment, and why, according to you, is this becoming more of an India problem? We haven't seen so many cases of black fungus post-COVID being reported anywhere else in the world.
So black fungus is that mucormycosis is a ubiquitous organ. That means it's there already in the environment.
Right.
But the problem is, because of the COVID, most of these patients are invariably on steroids, like especially in peripheral settings where the patients are put on steroids, but their glucose levels are not checked properly. So when the body blood glucose increases, automatically there is an immune suppression. So that is the point when this normal fungus that is in the environment becomes a pathogenic organism in the body, and it starts invading your blood vessels and starts affecting your sinus and the eye.
Right.
So definitely because of COVID, we are seeing a lot of cases of black fungus, but many a times it is because of inadvertent use of these steroids and improper maintenance of the blood sugar levels. That has been the most important risk factor. Apart from that, we also see in patients who are post-renal transplant or patients who are on other immunosuppression drugs, like for example, on transplant patients. So those patients are the ones who are really affected by the black fungus.
All right. So, could it also be then, Dr. Chawla, that, we haven't perhaps streamlined the use of steroids for COVID, and that's why we are seeing more number of cases here in India? Would you say that that's a reason?
Partially it is correct. The only thing is one of the studies which was published long back, right in the beginning of the first surge, that they found the steroid is the only which makes a difference in mortality. And the whole world started using steroids. But the appropriate timing and who should be given, it was never spelled out. Even in the guidelines, it is not spelled out. They gave very few milligrams for 6 days. That was the part of the study. But in our country, the steroids are started and they are never stopped. And over and above, we are the capital, we are the country where the diabetes is the maximum in the world.
Yes.
And these two combination has really resulted in 5,500 cases in our country.
Right.
Which is, normally seeing one mucor in the hospital is a news.
Yes.
In a year.
Yes.
So if you get one or two mucor, and now you are just seeing all around.
So what you're essentially saying is very important, because you're saying this is extremely rare. It exists, but it's extremely rare. And two reasons perhaps why India is seeing more cases than anywhere else in the world could be A, of course, the indiscriminate use of steroids in the treatment of COVID, and B, of course, because we have a high number of diabetes patients here. I also want to draw your attention, doctors, to the latest COVID numbers that are coming in. Once again, India registering over 4,200 deaths in the last 24 hours and over 2.59 lakh cases. Dr. Rahul Modi, if I can just draw your attention to the numbers, there has been a dip in the number of COVID-19 cases being reported in the last 1 week, 10 days, but the number of deaths continues to remain high. Why do you think the number of fatalities have not dipped at the same rate as the cases?
So if you see the way COVID progresses, the fatalities always lag behind the numbers.
Right.
Because once the diagnosis is made, it takes about 2 to 3 weeks for us to, for the unfortunate loss of the patient. So even at the start, when the numbers started rising, the fatalities took a while to catch up. And I feel given time, hopefully the numbers should also, the deaths should also go down, given that the numbers are going down.
Can we, Dr. Balasubramaniam, last word to you, can we say, if just looking at the death toll in India, the daily deaths crossing global records, can we say that the second wave has been deadlier? And, is this because of the nature of the variant strains, or is it just because of the sheer numbers that India has seen in the second wave?
So definitely the second wave has been more devastating than the first wave, there is no doubt about it.
Yes.
And one reason, as you rightly said, could be the variant mutations of viruses that we are seeing circulating in the country. But apart from that, what we have to realize is, like, with the success of the first wave, we became more lax. The lockdowns were released and people started getting back to their routine activities. That is when these people who are in the middle age start getting infected.
Yes.
And they carried these viruses to the entire family. So nowadays we see patients and the family coming together for consultation for COVID positivity. So one, definitely the variants play an important role, but the second, the most important thing is we need to stick to our pandemic norms, like social distancing, hand washing, wearing mask, and most important thing is getting vaccinated. So since there is a lax in the attitude of the patients also towards following this social distancing norms, that could have also played a very important role in faster spread of this virus, especially amongst close communities like families.
All right. Well, the silver lining is that cases have dipped. It is still 2.59 lakh new cases in the last 24 hours, but this also at a time when India is conducting a record number of tests. So there have been over 20 lakh tests that have been conducted in the last 24 hours. Deaths once again crossing that 4,000 milestone, over 4,200 deaths being reported in the last 24 hours. So those, of course, are the latest COVID numbers. Thank you so much, doctors, for sparing your valuable time and being with us on NDTV. We'll keep a close watch on all the COVID-related news right here.